communications is a remarkable area in healthcare. It's where public health and marketing sometimes meet Hollywood, or in the case of the Northern Territory, it's Bollywood. You can dance if you want to. What you just see, what you just seen is a rarity of health communications in the NT. This anti-smoking video went viral in East Arnhem Land via mobile phones, and it got me thinking about what made it so engaging for Indigenous youth. For the last couple of years, I've been confronted with the how-tos of youth engagement to promote health and well-being, particularly for Indigenous youth. And from some of the interesting findings, two things have become very clear to me. Number one, we need to rethink health communications for Indigenous youth. And secondly, we need to partner with and learn from Indigenous youth on how to step into the digital age of health communications. So in rethinking health communications, the question begs to be asked, is there something wrong with its practice today? And clearly something is, because across the board, Indigenous youth have poorer health outcomes compared to their non-Indigenous peers. We know the complexities, and we know the reasons behind them. But if I isolate health communications from the big picture, here is what I think is going wrong. Number one, we still have the top-down approach in youth engagement where the expert preaches to the ignorant. We need to start living in the present, and let's face it, this practice is less effective than it may have been in the past. In fact, I think youth no longer respond to it. They choose to engage through collaboration, participation, and social media. Youth have a greater capacity to reach out to their peers and be heard and to influence each other. Here is another reason why health communications for Indigenous youth needs a rethink. In the NT in general, health communications utilizes a one-way communication tool, and these are your posters, your ads, and your brochures. And we are required to, as subjects, or as the public, to read, watch, listen, understand, and then hopefully practice a healthy behavior. This is a linear method of learning where human behavior can presumably be altered through a set of rigid formulas. And we have become adaptive. We've adapted and we've been forced to adapt to this method of health communications, which makes health communications seemingly effective for us, but not for Indigenous youth. They come from the observe, do, practice method of communications, which is creative, intuitive, using metaphors, art, music, and storytelling to convey information and influence behavior. As you can see, there is a remarkable difference between these two methods of communication. One is prescriptive, expert-led, and the other is descriptive, community-led. And when I look deeper into health communications and examine the practice of education, even in its original meaning in Latin, this word does not mean to teach or to train. It means to bring out what is within, or to bring out potential and to lead. Australian researchers like Hughes and Dalowitz say that everything we think we know or assume is essential in Indigenous health needs to be set aside when designing Indigenous health systems. And they were not kidding, because everything just makes sense to me. In order for health communication content to be accepted and to be effective with Indigenous youth, it has to not only adapt to Indigenous ways of communication, it has to also enable and encourage leadership. I want to see a future where Indigenous youth are no longer passive consumers of health communication effort. And by the way, this was not taken at the Royal Darwin Hospital. I want to see Indigenous youth as active participants, reflexive still of their own challenges, and at the same time collaborating with with health services to create content that inspires healthy lifestyles. So let's apply the principles of Hughes and Dalowitz in health communications today and rethink what it means to them. Let me show you a video.
Young men from the Arafura Sea who breathed life into an Aegean classic to promote health and to have fun. A father of one of the Chukis popped it on YouTube. Over 1 million people watched, and overnight, these island boys became global celebrities.
To help young boys and girls to get off from ganja, all these things, and stealing, drugs, and mental illness.
Now that Frank has passed on, the Chuki dancers are even more determined to continue his legacy and promote his healthy lifestyle message.
You can see how Indigenous youth are using these tools in the digital age, and they're bringing their language and cultural elements with them. So we can no longer, as the wider community, assume that social media is culturally inappropriate. In fact, I think social media functions like a typical Indigenous community where collaborative consumption, participation, and social networking are their fundamental concepts. Except when I try to get the next slide. There is no fundamental concept here. It's just not working. That's right, here it is. I know from my own experience that it's not easy to express one's culture and to have a shared understanding about health as a minority youth group, and how much more difficult when youth face chronic disempowerment. Social media and mobile technology have become powerful tools for empowerment and social change. I want you to think of Egypt, but first, social change is necessary in promoting health in an Indigenous community, for they are a collectivist society, and here social change is very important. And when you think of Egypt, I want you to think of the Egyptian youth. Earlier this year, Egypt's youth created social change in their country by using mobile technology and social media. This is the Facebook page, "We are all Khaled Said," that united youth in a common cause. And the same happened in Malaysia. Young people were brought out by social media and mobile technology just last month to rally for fair elections on the streets. So let me tie these examples back to health communications and why it needs a rethink, and why we need to step into the digital age. And the reason is very simple. It's because health communications is ultimately about empowerment and social change. What we need is an attitudinal shift in the way health communication understands Indigenous youth's ways of communication and how it can support Indigenous youth in promoting health and well-being. As you can see, social media and technology are effective ways in mobilizing youth towards social change. It also understands Indigenous ways of communication, and it supports it. For my last example, I'd like to introduce you to the NT mobile journalists, or NT Mojos. And these are Indigenous youth from remote communities, and they're using social media and latest iPhones to document local stories of change and hope. You're looking at the future of Indigenous youth health communications, but for me, personally, this is the Egypt of Indigenous health. But that's not mind-blowing yet. Please, don't be blown away. Not yet. What will be really mind-blowing is when policymakers and leaders, communities and individuals recognize that this is not about being funky. This is not a transitional episode. And this is not entertaining a current trend. This is a transformational phenomenon. So I hope this time we shall seize every opportunity. Thank you.